So I'm going to talk to you guys about shame today and a little bit about co-occurring and how shame and co-occurring, the connection there. And I started researching shame a few years ago when I started to realize that it underlies every disorder that we work on. And you know, at a place like Timberline or at Sovereign, where you've got these, clients with complicated diagnoses, you start to realize really quick that as a clinician, you can only be so much to so people. You can't be an expert at everything. So I wanted to go after not another training, but a concept that I could go after that I knew if I got really good at treating shame, I could help anybody that comes to me, because shame underlies it. So I hope this is helpful for you today. I'm going to start with just a few statistics. Do you guys do a lot of co-occurring here? Yeah. Yeah? How many of you consider yourselves addiction specialists? Okay. How many people consider themselves eating disorder? Everyone else, you're just you do everything?
Mental health.
Okay. Did I hear? I don't know.
We don't have them all here.
Oh, okay. Okay. So when you're just looking at addiction treatment recipients, 65% of them have some other psychiatric disorder. And of those, 35% of them have an eating disorder. So that's compared to 3% of the general population. I did a talk not too long ago in Seattle at an all-women's addiction rehab. And actually, I think it was this talk. And they were kind of like, yeah, we don't have eating disorders here. And then I started, and it's all women addiction. So I started sharing some of the signs and symptoms. And you could see kind of their doe eyes going, oh crap, like we do have a lot of eating disorders here and we didn't even realize it. And as someone who came from the eating disorder field, a specialist in the eating disorder field, I was the same way. I thought I could just work with people with eating disorders, didn't have to work on addictions, and I got schooled really quick. And I got schooled really quick because 50% of women with eating disorders and men with eating disorders had an addiction. So here I thought back in the day that I didn't have to specialize in addiction, and I learned really quick that those two kind of co-occur, and so it's important to be competent in both. So if you're interested in learning more about this connection between eating disorders and substance, I would really recommend, you can download this for free online. It's the first report of its kind that just looked at the uniquenesses of treating eating and substance. It's really just a really helpful report. And I'll share with you some of the highlights from it. So really catching the dual diagnosis is key. And we don't even call it dual diagnosis anymore because dual implies two. And gosh, what's the most you've seen on axis one? On one diagnosis. Yeah, I mean you can have, unfortunately, definitely have more than two on axis one. So when we're looking at substance abuse as primary, and it's really important not just to catch the dual diagnosis, the co-occurring diagnosis, but to identify which diagnosis is primary. So if we're looking at substance abuse as primary, then usually what you find co-occurring with that is bulimia, binge eating, and anorexia purging type. And part of that is because of how it kind of manifests is similar to an addictive cycle, more so than just anorexia. We also find that people who have primary substance and an eating disorder secondary tend to have developed their substance abuse really early on. So these are the people who 11, 12, 13 started that issue. And then they also seem to have multiple dependencies. So if you've got someone with an eating disorder and a substance, you're going to see all of those three things. If eating disorders are primary, you're going to see a lot of anxiety connected with that. You're almost going to see that secondary and then the substance abuse tertiary to that. So this one quote pulled from that report, just because I think it highlights competence in this area. This lethal link between substance abuse and eating disorders sends a signal to parents, teachers, and health professionals. Where you see the smoke of eating disorders, look for the fire of substance abuse, and vice versa. So my advice is ask, ask, ask. Like I said, back in the day when I was a new therapist and I thought I was just going to work on substance, I had one client who was bipolar and ED, And we started having these conversations about pot. These conversations where she wanted to convince me that pot wasn't really a big deal. You ever have these conversations with your wife?
Yeah.
All the time.
Anyone have a good argument, please let me know, because I'm still working on my argument. And she came in one day, we had our session. At the end of the session, she said, I proved my point. And I'm like, what point? She said, I've been high this whole time. I don't think you knew it, did you? And I didn't know it. I didn't know it. And it was simply because I was uneducated in any of the world of substance use. Okay, so we treat them at the same time. We treat both at the same time at Timberline. At first, we were wondering if that was possible, if that was beneficial, and what we have found, and the research backs this up, is that it's optimal to treat them at the same time. It's not without challenges, and so I'm going to share some of those challenges with you, because if you're aware of the challenges, you can overcome them. The benefits outweigh the challenges. But there are some. Just looking at the addictions model, you have to address avoidance behaviors with eating disorders. With someone with an addiction, it's the opposite. You're trying to get them to not act on their addictive behaviors, but with someone with an eating disorder, they're avoiding areas where there are food. They avoid parties. They avoid you. They avoid their dietitian because they don't want to deal with food. And so there's this kind of just a different flavor with the avoidance behaviors with someone with an eating disorder. The other thing is obviously the environmental and social context cues. Our culture, our ideals of body image in our culture, they don't cause eating disorders, but they still play a huge part, especially in recovery from an eating disorder, because my clients tell me you can't go away from it. And they can know that it's true, but culture continues to, kind of slam it in their face that, thinness or an ideal beauty is just more important. The other thing that a straight addiction model doesn't address is the body dysmorphia and dissatisfaction. So we don't really know why a woman 90 pounds sopping wet thinks she's 200 pounds, but you have to address that when dealing with eating disorders. It's actually the most difficult aspect of symptomology to recover from. So you can have someone in recovery from an eating disorder for 10 years and they could still really struggle with their body image even though they're not acting on that behavior. Disease is identity. This was the most crucial one that when I started working in this co-field with my addiction specialist colleagues, I kind of didn't like the 12 steps. I didn't like AA at first. And the reason why I didn't like it was not because there was really anything wrong with it, but because of how some of my eating disorder clients responded to it and how it actually made my job harder. So they would walk into, let's say, an OA meeting, and what do you do when you walk into a meeting? Hi, my name is Margaret and I'm an addict, right? Well, for someone who's an addict, let's say straight substance abuse, it can become a really encouraging thing to know. And it can actually reduce their shame. With someone who's in the throes of their eating disorders, it's egosyntonic. And they come back and they're like, I have a disease. I'm going to live with it for the rest of my life. And it gives them motivation to just keep doing their behavior. Cunning and baffling. So obviously in the addictions world with substances, we talk about our substances being cunning and baffling and deceiving us. But in the eating disorder world, we talk about the substance as medicine. So there is no one psychotropic medicine that actually helps people with eating disorders. We use them. We treat other things around that, but they're not actually indicated. The best medicine, and I tell my clients this all the time for someone with an eating disorder, is going to be their nutrition plan and their actual food. So that's something that you have to navigate. And then obviously the abstinence or the relapse philosophy is a little bit different. I actually want my eating disorder clients to relapse because they need to learn from their mistakes. Not that we don't need to learn mistakes, from our mistakes and substances as well, but they're not going to eat perfectly the first time. They're going to be afraid of food. And so we talk about learning from lapses, not necessarily avoiding lapses. So there's not like this, 30-day chip that you lose if you relapse, right, with eating disorders. Okay, let's talk about the benefits, because like I said, they definitely outweigh once you're educated in dealing with the challenges. There is some research to support that the physiological effects of someone in the throes of an eating disorder cycle look similar to the addictive cycle, and that the brain starts to relate to the behavior the way an addict's brain relates to the behavior of whatever their addictive substance is. And so educating people with eating disorders on that is really helpful. That you want to throw yourself in a cycle? Okay, you're going to throw yourself in a cycle, and just be aware of that. And then we're going to have to help you out of that. 12-step groups are amazing for people with eating disorders. People with eating disorders love to isolate, love to avoid, and they hate groups. So they need them more than anyone needs them. And then there's a ton of eating disorder specific groups too, for people who have anorexia, bulimia, binge eating, that are very helpful. And then of course the research on shame shows that shame is common to both. And so if you can address the cycle of shame, you're going to help both. And group models really help with addressing shame. The final one, abstinence. Forget why I put this one here.
I just have a question about that.
Yeah.
That's been an argument that I've worked in my private practice for about 10 years, specifically like self-harm actually tends to pop up a lot with eating disorders as well.
Yeah.
And one of the things that I've struggled with is the argument that, well, for example, if I don't smoke pot, I'm not hungry. So marijuana helps me with that. Or as an overeater, if I use methamphetamines, I'm not hungry, so that I can lose weight that way. And so I've often heard eating disorders kind of will manipulate the substance into however it is that will aid their diet.
So thank you for just jogging my memory. It's in the wrong spot, and that's exactly the point. That there is that co-occurring thing. They will use substances to aid in their.
How do you combat that? Because I've really struggled with that because, I mean, there's
That's
a
why
logic
you have to
to
treat
it.
both at the same time.
Gotcha.
And that's when you do have to say you're addicted to
Right.
that substance because of what you get out of it. It's no different than someone who just goes after a substance. They're just getting something different out of it. They like the high, whatever it is. Yeah.
So they're justifying kind of because I feel like with eating disorders,
Yeah.
I've actually classified it as an addiction. It is an addiction. The highest
Yeah,
temptation.
so there's a debate. There's a debate in the eating disorder.
Yeah.
If you ask a straight eating disorder specialist, they would disagree with you.
Really?
But I don't want to get into that argument.
No.
That's why I talk about the challenges and the benefits. 'Cause,
Yeah.
you know, it doesn't need to be an argument.
Yeah.
But yeah,
No, but
there's still a
it
debate.
seems like it's like using drugs as a justification
Yeah.
to continue with their eating disorder.
Well, certainly, you know, there may be. Yeah. Yeah. There's a drug addiction component to that. You know, it's hard to say because it's so intertwined.
Yeah.
You know, whether they're dependent, drug dependent, or abusing. They could be drug dependent and, you know, or just abusing. Yeah, good question.
Excuse me, can you clarify, like, what did you said that it's not an addiction, an eating disorder? Like,
Oh, I
don't.
It depends on who you
So,
ask.
Well, can you tell us, like, your personal,
I would
like,
say it's almost 50-50.
okay,
There are professionals out there that are like, absolutely, it's an addiction just like any other addiction, and we do the addiction model of treatment with it. And then there are others, mostly the hardcore eating disorder specialists that have been around for a long time, who will say, of course, there's addictive like qualities and cycles, but it's not an addiction in the same way physiologically that a substance is. So that's all I'm going to say about that.
okay,
If we have time at the end, I would love to talk about it more, but
alright.
we could the debate will start.
Oh.
Okay, so let's talk about shame. Totally shift gears. This is a poem I found online that I want to share with you. A mother wrote it about her daughter, and it's called Waking Up Full of Awesome. And it's one of the first interventions I use with my clients. I love to use it in a group or individual. I just shared this poem with them, and I showed them the picture. There was a time when you were 5 years old, and you woke up full of awesome. You knew you were awesome. You loved yourself. You thought you were beautiful, even with missing teeth and messy hair and mismatched socks inside your grubby sneakers. You loved your body and the things it could do. You thought you were strong. You knew you were smart. Do you still have it, the awesome? Did someone take it from you? Did you let them? Did you hand it over because someone told you weren't beautiful enough, thin enough, smart enough, good enough? Why the heck would you listen to them? Did you consider they might be full of it? Wouldn't that be nuts? To tell this little girl that in another 5 or 10 years she might hate herself because she doesn't look like a starving and photoshopped fashion model? Or even more bizarre, that she should be sexy over smart, beautiful over bold, inebriated over sober. Are you freaking kidding me? Look at her. She is full of awesome. You were once, maybe you still are, maybe you're in the process of getting it back. All I know is that if you aren't waking up feeling like this about yourself, you are really missing out. So I share this with the women at Timberline, and I'll tell you the #1 feedback I get from them when they process. Dr. McGibb, I don't remember if I've ever felt that way. So what I tell them is, it's in there. You were born with it. Your addiction, your eating disorder, all of that has come against it. But sweet girl, I'll be back to this if it kills me. So shame. The research shows that it's highly correlated with depression, anxiety, addictions, eating disorders, and other psychiatric problems. They might as well just say it's correlated with everything. Now this was, that wasn't surprising to me with the research. This was like a golden nugget. Shame behaviors are highly correlated with relapse. So addictions, eating disorders, whether you believe it's addiction or not, it's all about relapse. It's all about relapse prevention with both eating disorders and addictions, right? That's such a huge part of recovery. And so if you deal with shame, you're actually going to reduce the likelihood of relapse. You're also going to reduce the level of relapse. So when someone comes into me in relapse, if it's a pretty intense relapse, I know shame is pretty intense. If it's kind of low relapse, shame's kind of on the down low. But if I deal with shame, it's the #1 thing I can do to help them with relapse and to avoid relapse. So, what is shame? How do I explain it to my clients? I don't give them the technical definition from the research. I tell them shame is a voice in your head. And that voice is really stupid. It only tells you 2 things. It just gives you different versions of those 2 things. And you guys remember, I don't think they make this game anymore, but you remember that game Taboo with the annoying buzzer? One day I'm going to get one of those buzzers, because we kind of do that in our groups, where we learn to identify the voice of shame, and they will buzz each other. Like, that sounds like Shame's talking. That doesn't sound like Susie talking. What does Susie think? Let's put shame aside. So shame sounds like some version of you're not good enough, or who do you think you are? So if they can learn that, they can start to see the difference between them, their wise mind, and then this voice of shame. So there are some gender differences according to the research. What do you think the #1 shaming belief is? The #1 thing that gets men when it comes to shame? What would the voice say? Yeah. Can I measure up? Is basically some version of am I measuring up? And shame gets triggered around this idea of appearing weak. Men don't want to appear weak. For women, it's, I hate to say it, ladies, as much, 20,015 power we think we have, it's still some version of appearance. So if you want to shame someone, I don't want to teach you how to do it the wrong way, but this is how you go for the jugular. Okay, the research talks about types of shame, and I'm really giving you the cliff notes. I've read pretty much all the research, and you're getting the highlights that are most, I think, salient, especially for clinical work. The 2 types of shame are internal and external. And internal shame is just that. It comes from within, and it's a measure of feelings. So someone who's high on internal shame, and you can test this if they're high or low on internal shame, they just walk around with all of this internal stuff that then everything gets filtered through their own kind of internal feelings that are shaming feelings. Someone with external shame, they're the opposite. They're very focused on what's happening outside of them. They tend to be hypervigilant. So they're the type of person that they will walk into a room, and you might not know it, but their mind is going, and they're thinking, gosh, I don't belong in here. look at all these amazing therapists, they've been doing this for a long time. I'm not quite sure I belong in here, right? So that's what their external shame is. So here, I'll give you a test. This is internal, external shame. Had a client who I'd been working with for a while, so she knew me, I knew her. And I took her into my office, I closed the door, we started our session, we did a little bit of the small talk in the beginning, and then she just looked really anxious. And I was like, are you okay? Like, what's wrong? And she said, Margaret, are you mad at me? You're mad at me. Why are you mad at me? What did I do? And I was like, I checked myself as a therapist, like, am I mad at her? No, not mad at her. No, sweetie, not mad at you. And then I just kind of brushed it off and, wanted to continue. And, she did that for about 5 minutes, and then she was like, no, you're mad at me, you have to, and she would not let it go. So finally, I was like thinking to myself, what, is there something on here that is exuding that to her? And, because she kept saying, you look like you're mad at me. So it finally hit me. I said, okay, it was a good thing I knew her well. I'm like, sweetie, I've been constipated all day long. So if there's anything here that looks like mad, that's probably what it is. And it wasn't until then that she just relaxed and we can move on. So high internal or external shame?
External.
Wow.
Do you have clients that struggle with both?
Yeah, they can swing.
Kind of just depending.
They can kind of swing. It is helpful to think about them and see kind of what they're. You'll see when we go further in the research, there are certain types of eating disorders that tend to lend more one than the other. You can think about it for yourself. I have one that I tend to favor more than the other. Okay, and then the research also talks about 2 major types of reactions to shame, but I'll also share a third that I thought was salient from the research. Shame aversion, shame proneness, and shame forecasting. So shame aversion, someone who's really high on this is the client that you kind of wear kid gloves around, because you learn the hard way that if you confront them too fast or too quick, they F you and they run out the door. You have clients like this? Okay. What I've discovered about them is they're not difficult. They're not, although that's all the feelings I'm having about it. They are so high on shame aversion, which means they actually feel shame quite deeply and they don't know what to do with it. They can't handle it. They have no shame resiliency. And so they have to avert it. And so they will often, they can't say I'm sorry. People like this who can't say I'm sorry. It's because they're highly shame averse. The other one is kind of the opposite of this, shame proneness. These are the people, these are the clients who are like, do you want your door open or closed? Is that okay that I said that? It's okay. Like they're constant, like they're like magnets and they're always thinking that it's their fault. That's the other side of, but they still feel shame very intensely. They just react. And then finally there's shame forecasting. And this happens, it's not really a reaction to shame, it's more of a temperament sometimes, where someone will be talking to you, be processing something, and you'll find that they're just forecasting into the future. Before it's even happened, they're just expecting something shameful, to happen.
Like a self-fulfilling prophecy.
Yeah, except it's particular to shame. Yeah. So recap on these are really the highlights that are going to help you clinically. I mean, think about it already. If someone's internal versus external, averse versus prone, you're going to treat them a little differently, understanding that. So it underlies most diagnoses. There's some gender differences. It's highly correlated with relapse. 2 types, 3 reactions. Okay. So any questions on the research? We're going to do a little more of the research in those particulars, but just on the basics. Good stuff, right? Makes sense. Okay. The rest of the presentation will be how I personally treat shame. So take it for what it's worth. It's based on the research. It's based on stuff that I do that I find really helpful. And it's based on my model of how I see people and my goal with my clients. So my goal, the literature calls it the biopsychosocial model. I take it a step further to biopsychosocial spiritual model. And so my goal is wholeness. My goal is not just to focus on one area, but to bring, because I feel all the areas of our being are interconnected, I can't help but have to focus on that. Because I could be doing some really good work here and missing something over here. So my definition of wholeness is basically just looking at how we're made up, and I describe that as body, soul, and spirit. So everything that I look at, I'm always looking at that lens, and then of course, higher power is connected with that. So we're body, soul, spirit, and then that connection with higher power, whatever that means to the client. So let's discuss them, and let's look at shame, and let's apply shame to each aspect of our client's being. So body, can you have body shame? Mm-hmm. Absolutely. In my world with eating disorders, it seems to be the main thing that we talk about in our sessions. It's the main thing that they can't seem to get out of their forefront. So our body is made up of our organs, and our senses. Our 5 senses help us connect with the external world. So my body is designed to connect me with the external world. The interesting thing about eating disorders is all the psychological and spiritual problems get what? Projected onto this machine. It's really just a machine. It's a great machine. It does wonderful things for me, but I project all of my stuff onto this body, and then that creates my body shame. So you have to do, if there's body shame involved with someone, and you can have body shame and not have an eating disorder, right? But with eating disorders in particular, because that body shame distorts how they see themselves and they project onto their body. Don't go away. Where's our little, can you help?
If you just unplug it and plug it in again,
Oh.
I just lost
I
my.
can do that. Anyone ever do body tracings? Part of their work? It's a great intervention to do with people who have any kind of body shame. Yay, thank you. And there's lots of ways to do it, but one of the ways I love to do it is first you have them draw out what they think their body looks like, and then you actually have them lay down on it and you trace them. So it gets at the distortion, but then we do things like collage to really help them see how they're projecting onto their body. And it's super intense. You don't want to just do it, when you have an extra 20 minutes in your session. You want to plan for it because it really will bring out their stuff.
Talk more about the collage.
Yeah, so we do it in the beginning. How do you feel about your body? Just give them something. And they do horrible things. They write disgusting. It's amazing what they put. But it gives you as a therapist a really. And then later, this is actually, I call it a redeemed body trace, where after she was able to see her body for what it is, she was able to put down all the real positive things about her body. Yeah, it was really good. Now, when looking at shame research, in particular with eating disorders, remember external and internal. High external is associated with anorexia, which makes complete sense. Anorexics are hypervigilant, they're very outward focused, and so they tend to have more external shame. It's part of the reason why they can look at a magazine and be so triggered, and you can look at a magazine and be like, okay, yeah, it's photoshopped, she doesn't really look like that. And she can't. They're just highly scrupulous, and it's always focused outside. And what does it mean to be a good person? And they need to look outside of them to get the answers to that. People who are high in internal shame, they tend to have more bulimia, self-injury, and self-contempt, because those are all behaviors that help them deal with what's going on. They can't tolerate what's happening inside, so they need to throw up, they need to binge in order to self-medicate. And then shame proneness tends to be associated with negative emotions around body image. Interestingly, when you look at shame and addictions, there's no correlation with substance abuse and guilt. Does that make sense? In fact, the higher the guilt, the lower the symptoms.
How do you define the difference between guilt and shame to your clients? Because I've noticed that's a difficult.
Yeah, so I'll put you on hold. We'll get there. It's a really good question. What's step 4?
Personal inventory, and when we're.
Why do we do that? We want them to begin to look at the consequences of their behavior on themselves and on others. What happens when they do that? Healthy guilt. And then they go, oh my gosh, I can't do that anymore. So guilt is healthy, shame is not healthy. Okay, moving on to the soul. comes from a Greek word. It comes from the word psyche. Sound familiar? So psychology, psychology, we could call it soulology. It means the same thing. And when you look at that word psyche, the Greek word, it means the mind, the will, behavior, and emotions. So that's the study of psychology, the interaction between your mind, your emotions, and your behavior. Make sense? And I make that distinction just because in our culture, we use soul and spirit pretty interchangeably. So I just want to explain that when I use the word soul, I use it in the traditional psychology Greek word etymology. And what is the soul? If my body connects me with the external world, what does my soul connect me with? Yeah, my internal world. So can you have soul shame? Absolutely. It looks like low self-esteem. It looks like stinking thinking, right? Cognitive distortions. So my soul gives me self-consciousness, self-awareness. It's my personality. That's my soul.
I don't care if you don't like me. I love me.
So that's my goal in the soul work. I want them to like themselves. You know what the number one thing is that keeps you, when you have those moments, we all have them, right? Where you wake up and you're like, I do not like that. It's because there's disconnect between what you're thinking, feeling, and how you're behaving. There's not integrity there. And so what we do as therapists is we help them pull out, what are you thinking, how does that connect with what you're feeling and how you're behaving, and how do we get that to be integrous for you, with your values and all that stuff, right? With your personality, and then all of a sudden they like themselves. So that's part of the work, and that sounds so simplistic. So, 2 quotes. You can't talk about shame without talking about Brene Brown. She is my hero, not because her shame research is groundbreaking, because when it came out I was like, well, we learned this 20 years ago. There's nothing new about her shame research. She's my hero because she's made it cool. Like, she's a researcher, and like Oprah knows about her, and she's helping people. And she was just this researcher, you know, doing her numbers. She says, shame is the swampland of the soul. So, soul is mind, will, and emotions. Shame gets you stuck. And now that I know this, whenever I'm stuck with a client, it's like, they're doing all the right things, you're doing all the right things. You're like, what is happening? Why are we stuck? It's a little red flag to me to say, okay, if there's shame involved, then let's address the shame. Carl Jung said, shame is a soul-eating emotion. Which I love that, because in the eating disorder world, we love to say, it's not what you're eating, but it's what's eating you. We do a lot of art therapy at Timberline. Art therapy is a great way of helping people get at, you know, what they're really thinking, feeling. It also gets at the spirit. But this was done by a client who had an eating disorder and an addiction, and she was depicting that battle in her soul. Why do I do the things that I don't want to do, and the things I want to do, I don't do? Can you relate to that? Well, that's the battle in the soul. That's the conflict in the soul, and she was depicting that. And that's part of what you need to deal with. Like I said, that's what creates soul shame when our clients are struggling. So, looking at the soul, the personality, there is some shame research connected with personality disorders. Remember aversion. That's highly linked with narcissistic and borderline personality. When I first read this, I was like, oh, that's why I have such a hard time with that. That's why I struggle to be compassionate with them, especially narcissistic clients. Because it feels like they don't want to admit to their stuff, right? They can't say, I'm sorry. Oh, they can't say, I'm sorry. They can't look at confrontation, actually, because they're so highly shamed. And they're like little kids. They have no resilience. And so that's why they react. So if I can know that about them, I can align with them, I can have compassion for them, and I can give them the skills that they need to deal with that. Shame proneness, and this also makes sense, is associated with dependent and avoidant personality. Okay, finally the spirit. This is my favorite thing to talk about, because I believe the spirit is the essence of who you are. Stephen Covey said, we are not human beings on a spiritual journey, we are spiritual beings on a human journey. Another way of saying that is you don't have a spiritual life, you are spiritual. You are spirit, you have a soul, and you live in a body. So what's the spirit? If my body connects me with the external world, my soul connects me with my internal world, what does my spirit connect me with? Yeah, the spirit of myself. What else? So the deep part of me. Huh? Purpose. Yeah. So our spirit is where we get our sense of, it's our essence, it's being with a capital B. So our meaning, our purpose, the reason why we're on this earth is the spirit. And it's also that part of me that connects me with the spirit of you. And therapists are really good at this, whether they know it or not. They just call it intuition. But if you ever have one of those sessions where you were like, angels should have been singing because you connected with your client and it was like an out of body, like there's something really profound happening and you give this wonderful interpretation and they're bawling and it's just, their life gets changed and you're thinking, I'm amazing. It's really was your spirit connecting with that. Do you ever meet someone and you're just like, I don't know what it is about her, but I know her. Do you know that you can actually build this skill? I've worked on building this skill for the last 5 years, and I can sit with someone, connect with them spirit to spirit, and tell them stuff. And they go, how do you know that? And I'm like, I don't know, but my spirit knows things that my mind doesn't know. And your spirit knows things that your mind doesn't know. And if you develop that, it's really cool. And if you get your clients to develop that, because what are they the least connected with? I mean, especially in the throes of their addiction or trauma or crisis.
Excuse me, so Vicky. Okay.
Have you ever seen someone go from 0 to 60? She won't even look at the dog. Okay, Sophie, what's your name? I have one question for you. Is a dog just a dog to Sophie?
No.
This is spirit in action. I don't know what it is about Sophie and her unique makeup and how she was created, but I don't know how old she is now, but I bet you in some way, in some shape, in some form, animals are connected for her. She's one of those people where animals is just everything to her. So that's what I'm looking for with my clients. What's that thing that makes them come alive that's so connected with them that if I walked in the room, I'd be happy to get a puppy too. You guys know I wouldn't be on the floor. And other kids wouldn't be on the floor. Other things would have me on the floor. And then finally, what's the connection with higher power? So can you have spirit shame? Absolutely you can have spirit shame. Low self-esteem is one thing. But now when it's connected to identity, that's a whole other thing, people. When my clients don't like themselves, that's one thing. But when they've been through so much trauma and abuse that they think they're worth nothing, and they say things like, I'm just a slave. Something has shifted. We're talking about the spirit now and his come right now. And that's so much more critical to their recovery than just doing some self-esteem. So yeah, it can affect higher power as well. And we can talk more about that later. Okay, so I really believe, this part you won't find in the research, but I believe shame is a spiritual concept. Because if shame is I'm bad, I'm wrong, then that's my identity. And so if I don't do spiritual interventions with them, with their spirit, I'm only giving them 2/3 of what's really going to bring them recovery. So shame moves us away from God, from higher power. It perverts identity, and it excludes us from others. How do I see it move away from higher power or God? We start the 12-step, education at Timberline. Maybe it's the first time they've ever been exposed to it. We just say the word God, higher power, and I lose like 20% of my residents. They're either mad. Don't use that. No, if we're talking about God, I'm out of here. Okay, what's that about? Higher power? No. Or, there's some version of something that's happening. And a lot of times it's just, when you get down and you talk to them, there's just shame. They don't feel deserving of this, even this idea that there's something out there that would want to help them. Okay, so looking at it all together, body, soul, spirit, essence, meaning, purpose, your heart, your love, hope, those things that you can't explain, like love and hope, that's all spirit. And then think about, who do you think you are? You're not good enough. It can affect every level of our being. And so what I do is I literally think, okay, what are the issues here? What are the issues here? What are the issues here? And what interventions am I going to do on each level? I educate them on this too. And all of a sudden, they don't feel labeled. They don't feel shamed. They go, oh, that's why I'm supposed to see the nutritionist. Okay, I can do that. Okay, so I'm going to give you a case study. It's actually a music video that I found, and so I do play this with my clients, my residents, to get them talking. So her name's Michelle, and I want you to be thinking about what's her history, what's her diagnosis, how do you see body shame, soul shame, spirit shame, and what hope do you see?
At the end,
Yeah.
hopefully.
Human trafficking.
Yeah, the end was hopeful. Yeah, human trafficking. You know why human trafficking is so hard to treat? Because identity. You pull them out, what do? They go right back in. Because their whole identity, their spirit has been compromised. They really think of themselves as slaves, which is what she wrote.
And then it was wiped off.
She wiped it off. Yeah, so she jumps in the water and She rips off the L to turn the slave into slave. So yeah, you saw self-injury, you saw eating in there, you saw some substance. You definitely saw the body shame, you saw the soul shame. And you saw the glimpses of the awesome. The little girl, the ballerina, who was dancing full of life, because of everything that came against her. Our girls really, unfortunately, can relate. So let's talk about interventions. Just like there's an eating disorder cycle and an addiction cycle, which I love to do with my clients, I actually have them draw out their own cycles. And we talk about interventions at any point of the cycle. There is a shame cycle, and it correlates with both of those. So it starts off, if you look at the top, and there's a cycle, so it could start anywhere. But there's some type of withdrawal, isolating from oneself, running and hiding because of the shame that they're feeling. That turns into attacking self, putting self down, calling yourself bad things, some masochism. The attack of self gets so intense that the person needs to have some avoidance because it's just so intense. How do you live yourself with yourself when you're attacking yourself? And so that's where denial can come in, and that's where, lo and behold, abusing drugs and alcohol can come in, using eating disorders can come in because it's a way to avert and avoid. And then that only lasts for so long, and then the other side of shame, you know how we talk about anger and hurt? It's shame and blame. So it's all about me, and then I can't tolerate that, so I make it all about you. It's still shame. The person that's like, you're a has just as much shame as the person who's like, you're a. So we track all of these, and it's so helpful for them to see where they're at in that cycle of shame. Because once they know where they're at, then they can begin to look at how to intervene. And you start with their strengths. So where's the area on the cycle that they actually have some pretty good skills? Go after that first. And don't start with the area where you're going to feel like you have not much to offer. And then here's, to answer your question about shame and guilt. Shame is, I am wrong. Guilt is, I did something wrong. So true guilt is, I think about the situation, yeah, that was messed up, I shouldn't have done that. You know, that's a great thing to find out, because all you have to do to make it better is make amends. Oh, you made a mess, clean it up, make amends. No big deal. False guilt is I am wrong. And oftentimes you'll be talking about, maybe a fight that they had with their mom or their spouse, and and you're really realizing this is not about what they did wrong, this is about their false guilt and I am wrong. And so helping them tease that out is so important. You can grow up in a shaming family, and before you know it, it's just how you think, it's how you exist. You can work for a shaming company, you can go to a shaming church, you can have a shaming boyfriend, you could be a shaming person. These are the rules in a shaming family. And this is so important to teach our clients, not so that they switch over into blame, because that's just shame, but so that they can have some understanding, like, this is why I struggle with shame, because I grew up in a shaming family. So always live perfect, always live in control, blame, don't feel, don't ask about feelings. There's a lot of third-party communication, unrealistic expectation, never be selfish, a lot of role reversal, and never play. Group therapy is so crucial because shame makes you want to hide and isolate, and that just perpetuates it. Secrecy perpetuates it, silence perpetuates it, judgment perpetuates it. But what alleviates it on the other end are empathy, vulnerability, and the Me Too factor. And that's what I'm always striving to get happening in my groups, that sense of like, wow, yeah, I do that too. Where someone shares their story and they're so afraid to share because they feel so horrible and they feel like you're going to judge them and you're going to think less of them. And how many of you know that happens to the person with the worst story, but it happens to the other person too? It's usually the most shamed client in the room is the one who is like, I shouldn't be here. Look at the horrible things they went to. Who am I to think I have problems? They actually experience the most shame sometimes in sharing because they feel like I don't deserve to be here. So psychotherapy treatment plan, I basically identify what are the wounds and the unmet needs, because shame always comes out of wounds, which result in unmet needs. And then what are the lies connected to that? So I don't talk about cognitive distortions with my clients, because that's just a fancy word, and it's kind of, it keeps them up in their mind. But when I say, what lies are you believing? You better believe they forgot. Because who wants to believe a lie, right? Especially about themselves. So what are the lies connected to the wounds? Where did they originate? With whom did they originate? We could do this with Michelle, in order to do some psychoed. We do some spiritual intervention with that. There's a ton of research. I could do a whole talk on this, but there's a ton of research on forgiveness. And forgiveness is actually a spiritual intervention that helps bring them back to their original identity. And they basically say, I'm no longer going to let this affect my identity. It doesn't mean what you did was right, but I'm going to release myself from that. So grieving losses, accepting limits, and then rebuilding identity and loss of that. That is the most important part. You need to do that on day one. I don't care how down in the dumps this client is. I don't care what level of crisis this is. You have to rebuild that from day one. And you have to have hope for that, because you absolutely can rebuild that from day one. We're running out of time, so I won't be able to talk about this, but the other thing is you want to build shame resilience, especially with your shame-averse clients. So you use the language of shame, you help them recognize the triggers. I have one client right now, he is amazing, but he gets so easily triggered, and I know when he gets triggered because he just gets mad at me and he just wants to be like, forget it. And he does that with everybody. Adolescents do this a lot, and it's usually because they just feel it so intensely. And so now he can kind of do that, and I can just kind of be with him, and he'll go, oh yeah, that was totally shame talking. That made me completely just want to kill you. Yeah, that was shame. You really don't want to kill me. Okay, so I'm going to give you my number one intervention for increasing, building up the spirit, and getting back to that awesome factor. It's a spiritual intervention, but what I love about it is you don't even have to worry about religion and ethics, because so many times people are like, well, how do you do this with clients? They have different religious beliefs, and it's like, well, I know that the spirit is identity, meaning, purpose, love, hope. If I can increase that, I don't care what religion you are. You all have that, right? So what I do is I actually connect them with their spirit. And you do that through music, art, creativity, meditation. So I will set up a station where they just sit in the room, and I'll give them different methods, because sometimes that's too much for them too soon. They can lie on the floor and just meditate, and I say, turn your attention towards higher power, God, whatever that is for you. If you believe it's out there, then give it an opportunity to connect with you and let you know what it thinks got you. But then I'll also have an art station, a music station, a movement station, so that they can use those things as a way to connect as well. So one day I did this with my group, and I had probably the most borderline client, honestly, I've ever worked with. To watch her really carefully in groups, because she had a way of taking over the group, and before we know it, we were down this way. And she would do that by getting really victim-y. And then, my shame-prone clients would be like, no, it's okay. And before we knew it, the group was about her, and the group was rescuing her, right? So we had the group, and she was the first one to volunteer to share her time connecting with higher power. And she immediately went into this victim thing. Actually, she was doing the victim thing with her higher power too. She called her higher power God. And she's like, so I was sitting at the art station and I was trying to connect to God, and I just kept thinking, God must hate me. God, just please forgive me, God. Please love me, God. And she was just like victim-y thing with God. And before you know it, the other women started, rescuing her, and I was sitting there, and I was not having a good moment. I was not being very adult. I was having a little tantrum going, I can't believe I'm trying to have this amazing, intervention where they can connect with spirit, and here she is, hijacking me. And then all of a sudden, she said, oh my God! I was thinking, oh, maybe she did connect with him. Awesome, or whatever God is. She goes, the whole time I was telling God, love me, forgive me, and God was speaking back. God was speaking back. Look at the red. Look at the red. Love for me. And something like she just knew in that moment that God was connecting with her. I would have never seen that in a million years, but she really believed God was showing her that. And something shifted in that woman. She was not the same woman ever since. And I was actually able to work on borderline issues after that, when something deep in her spirit was like, I'm worthy of love. And her higher power, God, showed her that in that moment. So, my number one intervention is to increase hope. If I can increase hope, then I'm going to strengthen their spirit. And if I strengthen their spirit, it's going to help trickle down into everything. How do I increase hope? My number one intervention for increasing hope is helping them identify their dreams for their life. So the hope research has shown that people who are high on hope have really amazing, lofty dreams for their life. And amazingly, they actually achieve them, even though these dreams are so lofty and seem larger than life. And what are our dreams? It's like Sophie and the dog. You know, they're so unique to us. So we do dream work. I get them to identify 10, 20. You guys, I'd make you do 100 dreams. And then day one in therapy, I don't care, like I said, they could have just come from the hospital being suicidal and they're now at Timberline Mills. We're helping them work towards their dreams. So I just want to share one video with you, and then I have to let you know, I'd love to talk Stride Gum. Somehow, I forget the story now, but Stride Gum got a hold of Matt's dream, and they said, yeah, we'll finance you to go around the world.
Oh.
So can I have 2 more minutes?
Yes.
Okay. I'm going to do an expressive technique with you that's going to bring it all together. Body, soul, spirit, higher power, and your dreams. But you have to be vulnerable. Silly therapists. They're the worst when it comes to this. We love dishing it out, but we can't take it. But the cool thing is, no shame. And I won't even know, because you don't even have to give me feedback. I hate this and leave and be like, that was the stupidest thing ever. Okay, close your eyes. And I want you to connect with your spirit. Now that probably sounds really like woo-woo, but just like settle yourself. And then imagine turning your attention towards whatever that means to you. Higher power, God, love, that thing that's bigger than you, that's outside of you, that thinks you're amazing, and that loves you perfectly. So whatever that is for you. I see smiles. That's good. That's good. Okay. Now I want you to come up with one dream for your life. And if you're badass, you'll come up with a really hard dream. If you're wimpy, pick a little dream. It's all good. Okay, raise your hand if you have one dream. For me, at one point, it was writing a book. Okay, good. Now, did you notice the thought you had right after your thought about your dream? So I want to write a book. My next thought was, I'm not a very good writer. It's usually some shaming thought. Okay, so go back to your dream, hold that in your mind, and now in your heart, I won't make you guys do this aloud, although I usually make my clients do it out loud. Just repeat after me, and this is where we're connecting with love and that, that knowing that's bigger than you. Repeat after me, is there a lie that I'm believing about my dream? So for me it was, I'm not a good writer. Can't do it. If you heard yes, then ask, what is the lie that I'm believing about my dream? Okay, the next question I want you to ask is, when did I first start believing this lie? And just notice, it'll take you, your spirit will take you right to the root. When did I first start believing the lie? That I couldn't write a book. Now, this always blows people's minds. Repeat after me in your heart. Who do I need to forgive who contributed to this lie? I actually was taken back to my very first writing teacher in my very first class in college. And I needed to forgive him for some things that he said that were really shitty based on my behaviors. So go ahead and in your heart, just, I forgive so-and-so for contributing to this lie about my dream. Now, obviously, if I was with you in a session, we would take this further. But we're getting a little taste. Now let's do this. And this part I will actually have you do out loud because it involves clapping really loud and sending a signal to your brain that we're shifting. So just repeat after me. I choose today.
I choose today
To break off the lie.
to break off the lie.
Fill in the blank. Now here's the fun part. Higher power, God, love. What is the truth? Hopefully you got something good. Super powerful intervention I do with my clients all the time, and they get it. They have that moment where this connects with this, and it's like no CBT, because it's like really connecting, and it's getting it all parts: body, soul, spirit, lies, truth, and it's connecting them with their spirit. So thank you guys so much.
Thank you.